The journey from medical school graduate to independent physician is arduous yet rewarding. Residency is a period of intensive training where aspiring doctors hone their skills under experienced physicians. It's a crucible where theoretical knowledge is forged into practical wisdom. Residents acquire clinical proficiency, critical thinking, communication, and leadership skills. These skills are the cornerstones of competent and compassionate patient care. This rigorous training ensures residents graduate as competent, confident, and compassionate physicians. At the heart of medical residency lies the development of clinical skills. These skills form the foundation upon which residents build their medical careers. It's about seamlessly integrating knowledge, experience, and intuition to deliver effective and compassionate patient care. Residents learn to perform a vast array of procedures, from basic life support to complex surgeries, under the guidance of experienced attending physicians. These hands-on experiences are invaluable, transforming theoretical knowledge into practical skills. Through repeated practice and constructive feedback, residents gain proficiency in essential procedures, mastering the delicate balance between confidence and caution. But clinical skills extend beyond procedural competence. Residents develop a keen eye for detail, learning to recognize subtle signs and symptoms that might elude a less experienced observer. They learn to approach each patient as a unique individual, considering not just the disease, but the person it affects. This holistic approach is cultivated through countless patient encounters, each one a learning opportunity that contributes to the residents' growing clinical acumen. Residency is as much about honing diagnostic skills as it is about mastering treatment. Residents learn to think like detectives, piecing together clues from a patient's history, physical examination, and laboratory tests to arrive at an accurate diagnosis. This process requires not just memorization of medical facts, but the development of critical thinking and clinical reasoning skills. Residents are trained to analyze information systematically, weigh different possibilities, and formulate a differential diagnosis. They learn to ask the right questions, listen attentively to patients' narratives, and identify key pieces of information that may hold the key to the diagnosis. This analytical approach is further honed through participation in case conferences and journal clubs, where residents present and discuss complex cases with their peers and senior physicians. The ability to defend their diagnostic reasoning, consider alternative perspectives, and incorporate feedback is essential for their growth as clinicians. This continuous process of learning and refinement is what sets apart a competent physician from an exceptional one. The Bridge of Healing. Words communication in residency. Effective communication is the bridge that connects physicians with their patients and colleagues. Residents learn to communicate clearly and empathetically with patients from diverse backgrounds, explaining complex medical information in a way that is understandable and relatable. They master the art of active listening, creating a safe space for patients to share their concerns and fears openly. But communication extends beyond the patient-doctor relationship. Residents also learn to communicate effectively within the healthcare team, conveying critical information concisely and accurately. This includes providing clear and concise patient handoffs, writing comprehensive medical notes, and actively participating in multidisciplinary rounds. Navigating the labyrinth critical thinking in residency. The healthcare landscape is complex and ever-evolving. Medical residents are constantly challenged to think critically, analyze information, and make sound judgments, often under pressure. They learn to question assumptions, challenge the status quo, and seek evidence to support their decisions. This ability to think critically is honed through exposure to a wide variety of cases, each presenting its own unique challenges. Residents are encouraged to stay abreast of the latest medical advancements, critically evaluate new research, and incorporate evidence-based practices into their clinical decision-making. They learn to adapt their approach based on the specific needs of each patient, recognizing that there is no one-size-fits-all solution in medicine. This adaptability is crucial in today's dynamic healthcare environment, where new challenges and ethical dilemmas emerge regularly. For more information about healthcare residency supportive consultation services by Journal Academy and Gulf Index U organizations, you can visit our website www.residency.journalacademy.in.